Bismillahirrahmanirrahim. My name is Aisha Khan. My roll number is BP1650048 and my topic is atropine. Introduction of atropine. Atropine occurs in the various plant of nightshade family, deadly nightshade called belladonna, and belongs to the family Solanaceae, and is characterized as an anticholinergic drug. Atropine is a natural alkaloid and a potent antimuscarinic effect used to treat bradycardia, bronchospasm, and vagal stimulation. Now, rational uses of atropine. Suitable doses of atropine can stop various types of reflex cardiac slowing of systole. The drug can stop bradycardia and parasympathetic drugs and cardiac arrest produced by stimulation of the vagus. Atropine may lessen the degree of partial heart block. In some patients with conduction defect, atropine may cause paradoxical and atrioventricular AV block and nodal rhythm. Irrational uses of atropine. Atropine lessen discharge in the mouth and respiratory passage, relieve the constriction and spasm of the respiratory passage, and may decrease the paralysis of respiration that result from toxic nerve agent which increase anticholinesterase activity in the CNS. Atropine Atropine is an unreliable respiratory stimulant, and large or repeated dose may depress respiration. Now, the alternative choices of atropine. Atropine is contraindicated with patients who have hypersensitivity issues and have allergic reaction like anaphylaxis, intense flushing, which is also known as cyanosis, bluish area, and it's called atropine flush and is not harmful and when it occurs because of potential for toxicity, atropine should not be administered in dose exceeding those recommended. If atropine is unavailable, intravenous glycopyrrolate or diphenhydramine may provide as alternative anticholinergic agent for treating muscarinic toxicity. However, glycopyrrolate does not cross blood-brain barrier and cannot treat CNS issues. Now, now move towards the three alternative brands available for atropine. The name are Atrosol, Atrovine, and Alitropine. Drug-drug interaction. When atropine are given with the combination of paraloxam are used together, sign of mydriasis, tachycardia, dryness of mouth may occur, and when it with relate with combination with the barbiturates, as they are potentiated by anticholinesterase, therefore it should be used cautiously or in the treatment of convulsion resulting from exposure to atropine. Some the name of the drugs which increase the atropine effects are quinidine, diphenhydramine, and metazine. Atropine toxicity and antidote. If atropines are overdosed, so can lead to the flushing of skin, mucous membrane, photophobia, extreme confusion, hallucinations, fatigue, and other side effects. But how we overcome that toxicity? Then we have to give the antidote, which is physostigmine salicylate, 0.5 to 1 milligram IV for 5 minutes in a slowly infusion, along with the ECG monitoring. Then the dose should not be exceed than more than a 2 milligram. Now toward the case study. A 29-year-old male self-administered mistakenly 10 milligram IV atropine. Within a minute, patient was brought to the emergency department and the patient was conscious, nervous, and the bradycardia occurred. The patient has exophthalmos and impaired accommodation. Her blood pressure was 170 to 110 milligram Hg and the heart rate is 165 beat per minute. Body temperature is normal, but after 10 minutes, her respiratory distress occurred and the patient began to increase and patient was incubated for airway control and transferred to ICU. In ICU, ECG was again applied, sinus tachycardia was observed, heart rate now become 145 beat per minute, and we are not given any additional cardiac drugs because of sinus rhythm. Now we have to give there is now we have to give 0.5 ml stigmine was administered and a midazolam infusion start. Tachycardia was strained at the end of the second hour, and at the fourth hour, consciousness was recovered and patient now feel much better. Now to move toward the subject SOAP note, which is consists of subjective, objective assessment and plan. Subjective. The age of the patient is 24. Mistakenly administered 10 milligram of atropine. Now objective. Blood pressure is 170 to 110 milligram per kg. Heart rate is 165 beat per minute. Now and then after 10 minutes it will become 145 beat per minute. Patient was conscious, nervous and tachycardia will occur. Assessment. Sinus tachycardia was observed, respiratory distress and agitation increased, so the patient will transfer to the ICU for intubated airway control. Now, what's the plan? Anticholinergic drugs are used as overdose treatment of anticholinergic. First choice of drug is physostigmine, but if it's not available, midazolam infusion should start it. No additional cardiac drug was given because of sinus tachycardia is present in the patient. For peripheral effect, 0.5 milligram neostigmine was administered. Thank you so much.